There are two main types of cholesterol: high-density lipoprotein HDL and low-density lipoprotein LDL. Lipoproteins are made of fat and proteins. Cholesterol moves through your body while inside lipoproteins. HDL is known as good cholesterol because it transports cholesterol to your liver to be released from your body. HDL helps rid your body of excess cholesterol so it's less likely to end up in your arteries. LDL is called bad cholesterol because it takes cholesterol to your arteries, where it can collect in your artery walls. Too much cholesterol in your arteries may lead to a buildup of plaque known as atherosclerosis. This can increase the risk of blood clots in your arteries. If a blood clot breaks away and blocks an artery in your heart or brain, you may have a stroke or heart attack. According to the Centers for Disease Control and Prevention (CDC), nearly 12% trusted source of people in the United States have high cholesterol. You may not even know it because high cholesterol doesn't cause noticeable symptoms. The only way to find out if your cholesterol is high is through a blood test that measures cholesterol in milligrams per deciliter of blood, milligram per deciliter. When you get your cholesterol numbers checked, you'll receive results for total blood cholesterol. This includes your HDL, LDL, and 20% of your total triglycerides. Triglycerides. This number should be below 150 milligrams per deciliter. Triglycerides are a common type of fat. If your triglycerides are high and your LDL is also high or your HDL is low, you're at risk of developing atherosclerosis. HDL. The higher this number, the better. It should be at least higher than 55 milligrams per deciliter for females and 45 milligrams per deciliter for males. LDL. The lower this number, the better. It should be no more than 130 milligrams per deciliter if you don't have heart disease, blood vessel disease, or diabetes. It should be no more than 100 milligrams per deciliter if you have any of these conditions or high total cholesterol. Plaque buildup may also reduce blood flow and oxygen to major organs. Oxygen deprivation to your organs or arteries may lead to kidney disease or peripheral arterial disease, in addition to a heart attack or stroke. Lifestyle factors that may cause high cholesterol are obesity, diet high in red meat, full-fat dairy products, saturated fats, trans fats, and processed foods, large waist circumference over 40 inches for men or over 35 inches for women, lack of regular exercise. According to a 2013 review trusted source, smokers typically have lower HDL cholesterol than non-smokers. Research shows that quitting smoking can increase HDL. If you smoke, talk with a doctor about smoking cessation programs or other methods to quit smoking. It's unclear if stress directly causes high cholesterol. Unmanaged stress may lead to behaviors that can increase LDL and total cholesterol, such as overeating fatty foods, inactivity, increased smoking. In some cases, high LDL is inherited. This condition is called familial hypercholesterolemia (FH). According to the Family Heart Foundation, FH is caused by a genetic mutation that affects the ability of a person's liver to get rid of extra LDL cholesterol. This may lead to high LDL levels and an increased risk of heart attack and stroke.
You're never too young to start thinking about preventing high cholesterol. Eating a balanced, nutritious diet is an important first step. Here are some changes you can make today. Swap traditional pasta with whole wheat pasta, and swap white rice with brown rice. Dress salads with olive oil and a splash of lemon juice instead of high-fat salad dressings. Eat more fish. Aim for at least 2 servings of fish per week. Swap soda or fruit juice with seltzer water or plain water flavored with fresh fruit slices. Bake meat and poultry instead of frying meats. Use low-fat Greek yogurt instead of sour cream. Greek yogurt has a similar tart flavor. Opt for whole grain cereals instead of sugar-filled varieties. Try topping them with cinnamon instead of sugar. Exercise may also have a positive impact on your cholesterol levels. If you're inactive most of the day, make an effort to move more. If you work at a desk, set an alarm on your cell phone or computer, or get a fitness tracker to remind you to get up and move for 5 minutes each hour. Try to fit in at least 30 minutes of exercise daily. Walking, Swimming, or riding a bike are great options. If you smoke, talk with a doctor about how to stop. Smoking increases your risk of high cholesterol, high blood pressure, heart disease, many types of cancer. If you don't know your cholesterol numbers, ask your doctor about getting tested, especially if you have a family history of high cholesterol or heart disease. The earlier you know your cholesterol numbers, the sooner you can take steps to manage them.